When somebody in detention speaks to a doctor, is what they say to the doctor treated confidentially?
The confidentiality of medical consultations is a very problematic issue in detention because the medical records are owned by the department. And although there are some consent procedures about the use of medical information, they are, in my view, really inadequate. People, when they arrive into detention, sign a consent form which says that their medical information can be used to assist with placement and other issues to do with their processing. People, I believe, disclose a lot of personal information, which is then recorded in notes, which then is available to non-medical people for other purposes.
To be used against them?
Yes, to be used against them in the sense that, particularly to do with placement and offshore processing. If people disclose elements of their health history, which establish that they are fit and healthy and therefore eligible to be sent to offshore processing, then that's being used against them, I think.
Would one way of protecting the records of detainees and also perhaps improving their health, that the doctors report not to the Department of Immigration, but to the Department of Health, which I understand is how it works with prisons?
One of the fundamental ethical problems that we face working in a system is that the health providers are working for the department, who is working for the government, which is implementing these policies which are causing harm to health. And we are duty bound then to be acting for them as well as we're acting for the patients in the system who are being harmed, and that creates an inherent conflict. And that's been understood in other settings, like in prisons. And that's why in some Australian jurisdictions, for considerable lengths of time, like in New South Wales since 1968, I understand that the health services have been reporting through the Department of Health rather than through corrections.